other blood tests do you think patients should know? And again, if you have any questions about enlarged prostate, elevated PSA, and prostate cancer, we have Dr. Misalek, who are a good pathologist from Boston, who is here to help us with some of these tumor markers. What's out there? What's available for someone who's elevated PSA to decide whether we should go and get biopsy or not?
So the first one people should know about is what's called PHI, Prostate Health Index. And what that is can be thought of a next generation PSA test, in that it not only combines the power of your PSA marker, but two other forms of the PSA molecule that are found in the blood, and it can stratify and give your doctor a percentage of whether tumor is going to be found or not. So it's another tool for us to see if that elevated PSA is really indicative of cancer or not.
So Prostate Health Index, which is a blood test, and you would get a form back that will give you a percentage of the risk that you are going to have prostate cancer or not. So the doctor would receive whether it's a low risk or moderate risk or high risk, and we're trying to decide whether we should do a biopsy or not. So the purpose of all of these tumor markers is to reduce unnecessary biopsies, and that's really the lesson that we're passing on to the listeners, is that not every elevated PSA means biopsy, not every positive biopsy means robotic or surgery, and not every surgery means incontinence and impotence. That's just like very simple, and it's not correct. Okay, so PHI, what else do we have in the pipeline?
So we've got what's called the 4K score. Write that one down. That's another good one, and that also looks at different forms of the PSA molecule that can be found in your blood. And this one gives the percentage or chances of you having an aggressive prostate cancer. One of the criticisms that over-testing critics will say is that we're finding too many low-grade indolent cancers and treating those. But this test can help your doctor figure out if your cancer is one that should be treated, it's one of the more aggressive types of cancers, versus the ones that we can watch and do maybe watchful waiting for.
So we have PHI, we have 4K tests, and now and we have PCA3 urine test.
Yep.
That will show whether there are any cells. And all of this, by the way, is available in our center in Madison Avenue. And if you have further question about this, you can call 212-365-5000.